Hello everyone. Hey, today we're here with Michelle. Michelle is our financial coordinator, and unfortunately for Michelle, she had a cracked tooth that needed a crown, and so today the crown is in, and we're gonna cement that in her mouth and give her a new tooth back, the one that doesn't hurt, one that's not cracked, one that's gonna be good for her. Now, it's a very common question that people ask me when they have a crown cemented. Do they have to be numb for the procedure? And the reason that I'm shaking my head that way is because when we clean off the tooth, it's sensitive. You have tooth structure that's exposed, that's not designed to be exposed, and I'm going to be working around cleaning off the cement, getting the tooth ready, prepared to receive the crown and the cement that goes along with it. And I don't want to hurt. I don't want any of this to hurt you, right? So what we're going to do is we're going to go ahead and get it numb. You know, we did a great job when we worked on the tooth. We got it all numb. It didn't hurt while we were working on it, so there's no reason why you should hurt having the crown cemented. So the thing about that, though, is people are afraid of needles. And I want to show you this. This looks super scary, right? Look how big this thing is. But what I want you to understand is that this is the anesthetic, and this is just something to push the anesthetic into the body. The only part that goes into the tissue that does anything is this tiny little piece right there. I don't know if you can see it up against the backdrop of my shirt maybe, but you can see it's tiny. It's super tiny. And there are techniques, there are ways to be able to use this and work with it that's not painful. That's what we're going to attempt to do, to show you exactly how this works. So let me get myself prepared here, and we will get Michelle all numb. Nice and easy. So, first thing that we want to do is we want to make sure that Michelle's open nice and wide. If she's open nice and wide and stays open while we're working, then the anatomy stays in the same spot. That way it's easier for us to find the position that we need to be without having to hunt around and inadvertently touch an area that is sensitive to her. So we have her open nice and wide for us. Turn toward me just a little bit so I can see you very clearly. Stay open really big for me and nice and relaxed, but really wide, okay? And we find the spot that we want to go, and then just a little distraction technique. Wiggle the lip just a little bit. And so that's it. Right now, the rest of this is just simply delivering the anesthetic. And no, we're not on slow-mo. I am actually delivering the anesthetic this slowly. And the reason that I'm delivering this slowly is because the pinch of the needle, this insertion of the tip of the needle, is not the part that causes people trouble. The part that causes them difficulty is delivering the anesthetic for two reasons. One, because it distends the tissue. It pushes the fluid into the tissue, which pushes the tissue away and then causes them discomfort. The second thing is the acidity. You put a material in there that's a little acidic, and then they feel kind of a sting. So if you can deliver it very slowly, then they don't feel the distension of the tissue, and they don't feel the sting of the material, and they don't feel anything. They wonder why I'm taking so long, but they just sit nice and calm and relaxed, and we deliver the anesthetic nice and slow, and then she gets all numb. So I'm going to finish this real quick, and then we're going to wait just a couple of minutes, and then she'll be all numb and we can cement the crown in place. But you can see, super easy. When you're calm, when you're relaxed, we just insert the needle. You don't even feel that. Did you feel anything? You didn't feel anything at all? Little distraction technique is all it takes sometimes, and very simply deliver the anesthetic, and voila. So now, in all honesty, was it uncomfortable in the slightest?
No, not at all.
Did you feel even a pinch of
no pinch,
anything?
no sting.
No, nothing.
My lip is numb.
Your lip's already numb?
Yes.
So you get it in the right spot, it happens pretty quickly.
Yeah.
And we'll still give it a little bit of time, and then we'll get started. Okay.